Hi, everybody. Again, I'm Dr. Elamin. You can call me Dr. E, and we will talk briefly today about vaccines. Of course, this topic is very important. Vaccines have done a lot to children. We have gotten rid of a lot of diseases through the history of vaccines, like polio, poliomyelitis, measles, except outbreaks here and there. And like in old history, like smallpox, which is for children and big people, which was a fatal disease, and you cannot see it now because of the favor of vaccines. So I want to talk a little bit on it. Start about myself. As I told you, my full name is Father Aman Al Amin. Call me Dr. E. I am originally from Sudan, medical school there, but I got my residency in Ohio, in Northside Medical Center, in Top Children Hospital. That is 20 years ago. And I worked there in Ohio at Robinson Memorial Hospital and Akron Children Hospital, and worked also overseas in many continents, Asia, Africa, and now happy to join Hamilton Clinic to give the juice of my experience to the children here around me. And I am board certified and a member of American Academy of Pediatrics too. And I guess this is a background about the children's vaccines. Of course, when vaccines were introduced, there is hesitancy began back in 1700. At the end of the 17th century and the beginning of the 18th century, after the first smallpox vaccine created. Of course, there is a lot of mess and a lot of chatting and a lot of resistance to take it. A lot of skepticism and suspicions and about the vaccine. Clergy said it was, this is one of the scientists that time, it was a violation, or Clergy is one of the is an activist at that time. He said it was a violation of God's will generally. But I don't agree with that. If a human being can protect himself, like from diseases, from death, from anything, we can do the best to do that. Modern vaccine hesitancy began in 1998 after Andrew Wakefield, a gastroenterologist, published alleging in the MMR vaccine caused autism. They linked, theoretically, they said that MMR can cause autism without scientific basis. So they did a very small number of data for a study, which is not effective. But it was deterred by large epidemiological studies over the following decade. Consistently found no evidence at all to link autism to MMR. In 2004, 10 of his co-authors related their report. Like they retracted, they retracted it from to be included in the data. They said it is invalid. In 2010, the Lancet, where the report was published, retracted the paper, citing several inconsistencies. So everything was said against MMR is retrieved, and it's proved to be false and not true. And through my practice, like 20 years, I never had a case of autism related to MMR, never at all. And even autism itself is like something which is of unknown cause. Nobody can give like a direct cause which cause autism, but it's proved not related to vaccines. Cognitive biases, a systemic thought process caused by the tendency the human brain to simplify information processing through a filter of personal beliefs and preferences. So group 1 vaccine related information processing strongly dependent but it is content and patient aspects. We can take the pictures here, please. Yes, thank you. Group 2, during vaccination decision-making, uncertainty in the vaccine, omission bias, risk perception. Group 3, pre-existing belief about vaccination that has a bigger impact on actions than the content of the information available, i.e. religious beliefs, information bias. This is a scientific like quotation. Just forget it. But the summary of it is that any statement against vaccine was like invalid because it has no basic data, it has no strong evidence-based medicine. So all are taken off now, and now there is no like any paper against vaccine in the medical field. Also, people receive information from internet. 43% of misinformation on social media is about vaccines. Those that get information from social media are more likely to refuse or delay vaccine. Social media is designed to reflect an individual's prior search pattern, meaning it would show similar information to what they have been shown, searched before, regardless of fact. In summary, like general information doesn't stand on scientific base, doesn't stand on like trials and experiment and research, which we do in medicine, which has never proved something wrong with the vaccines. So here are some top reasons parents delay or not vaccinate, like personal belief, religious, philosophical reasons, believe vaccines are not safe, believe vaccines are not effective or necessary, desire for more information from healthcare. So as I said, if you take number one, like for personal belief or religious or philosophical reasons, this is not scientific. We need scientific data which support vaccines. We have it. It proved no connection to disease, and it proved vaccine are protective to children from a lot of diseases. Believe vaccines are not safe, and this is proved wrong. It will come in. I will show you some studies which prove that. Believe vaccines are not effective, which is totally biased and not true. We have diseases taken off from our like dictionary now because of the vaccines. So like many parents believe the side effects of vaccines are more extensive than that they are told by their physicians, and that the risk outweighs the benefits of vaccinating their children. And this is false. The side effects of vaccines, and it will come in the lecture, like it's mainly pain and redness. Some kids feel uncomfortable. Rarely you can see an allergic reaction. And if a child develops an allergic reaction, this is a contraindication to vaccination. And it should be a major allergic reaction, not like a small localized one, which is even will not be treated. Vaccines are not safe due to rumors, false studies. As I said, from where you got this information, from internet, from social media, from like personal beliefs, this is not true. Vaccines are safe. Here we say that vaccines are safe as shown by more than 50 years of research and experience among hundreds of millions of Americans who have been immunized against influenza, for example. So this is kind of research. Currently, the United States has the safest vaccine supply in its history. Millions of children safely receive vaccines each year. The most common side effects are very mild. As I said, pain, swelling at the injection site. And if you take any injection, you can have this side effect. If you take a penicillin or antibiotic or painkiller injection, you can feel this. So this is not a contraindication. This is not specific to vaccine. It is a general side effects for most of medicine given by injection. And I will tell you in this point here, some vaccines are used outside the United States. In the United States are not, they are not like allowed to be used. I know two or three. That means here in America, like the FDA and the American Academy of Pediatrics are very strict for the health of the children in America. Vaccine approval. Vaccine is the best way to help protect you and your family against serious diseases. So FDA regulates vaccines to make sure, as I said, CDC, which is Center of Disease Control, provides clinical guidance for vaccine use. Before a vaccine can be approved, it must go through years of testing to show it is safe, effective, and its benefits outweighs the risk. As I said, vaccines going to trial for years and years, maybe more than 10 years. First in animals, then in a group of volunteers, then in a limited number of population, those all volunteers. Then in a huge number in one center or population, then we make it like bigger. The CDC and FDA make it in multi-center meta-analysis data, like from Florida, from Michigan, from California, from Indiana, and sometimes from UK, or like France. We make like multi-center studies for hundreds of thousands of children to make sure it is safe. And after we get the information from this multi-center data and we make analysis and proves it safe, then we apply it and FDA approves it to be used by American children. So it is very safe. It is well studied. It is well documented. It is very, very safe. Vaccine myths debunked. Delaying vaccine or not following the recommended schedule is more safe for the child. Let me tell you something. No, that is wrong. And if you observe, even in the immunization schedule, we have immunizations we give as early as the first day of life. We have immunization, we start them at 2 months. We have immunizations, we start them at 1 year. I'm speaking out of the slide now, just to explain to you. We have vaccines, we use them at the age of 11 years. We have vaccine, we use them at the age of 16 years. We have vaccines, we use them at the age of 18 years. So everything is studied and well documented and well scheduled at the perfect time to get the maximum immunity against the disease and the safest administration without side effects and without damage to the child. So this should debunk the myth about vaccines. So some people say vaccines are not needed or effective. Let me ask a question. Where is the smallpox? Where is polio? Where is measles? Where is chickenpox? Some of these diseases which I mentioned have vanished. Some of them you can find outbreaks here and there. And when you follow there, you will find some kids unvaccinated because of this myth which we talked about. So this is totally rejected by scientific data. And you know the proof. Everybody can talk like me. Any mom, any dad can talk like me about this. Flu shots. Flu vaccine cannot cause flu illness. Flu shots are made with either inactivated killed virus or with only a single protein from the flu virus. The nasal spray vaccine contains live virus. So this is about the flu. It proves its effectiveness throughout the decades. And just a small comment here, live virus is only found in the nasal spray. And it is just contraindicated like for immunocompromised, like some people with cancer or using immunosuppressive medicine. We don't give them these. But the other injectable flu vaccines, inactivated or killed, and they contain a single protein. So no worry, it is effective, it is safe. And the doctor should take care of any precautions before giving the flu vaccine. They ask history, do you have any, are you using any medication? Do you have any chronic condition or blah, 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 to make sure you are safe. Contraindications. In generally, we say generally there is no contraindication for vaccines. The only contraindication if you give a child a vaccine and he has severe life-threatening allergic reaction. Another thing is if you give a vaccine and it causes seizure, you should not give again to the child. Okay, and like a lot of people put hypothetical or non-existing side effects, but we never saw it. And in my life, maybe I saw one or two kids like they developed seizure or allergic reaction in these 20 years, one or two kids. So it's not something to hold you back from vaccine. It is just encephalitis also is a contraindication. I never saw it in my life, but it is reported. That is why I'm telling about. So in general, the contraindications are non-existing, and it depends when you administer a vaccine, it causes a serious effect like seizure, encephalitis, or severe life-threatening allergic reaction. When I say that, you cannot say that I have a vaccine here and it is red, itching locally for 2 days or 1 day or whatever, and you say this is no, this is not a contraindication. Life-threatening, it interrupts your breathing, it affects your heart, it multi-system effect. Why vaccinate? And I think this is, I hope people got why vaccinate answer from what I told. Protection for kids, healthy kids, avoidance of permanent disability. Look at polio, it causes paralysis lifelong. Look at tetanus, vaccine. If a kid or a person got tetanus, it's difficult to treat, it's a fatal disease. And go on, measles can cause like some called like subacute panencephalitis, which occurs like 6 months, 6 weeks to 6 months later from the disease, and it will cause a permanent disability. Varicella, chickenpox can cause myocarditis and can very severely affect pregnant ladies, cause fatalities in them. So that is why we vaccine. The better we get to vaccine, protection, stay safe, no complication, no link to autism, no link to any other chronic diseases caused by vaccine. This is well proved by studies, researches, and meta-analysis data collected from all over America, plus all allies in Europe and Asia, like Japan, UK, France, Germany, and multi-centers here in America. So this is very well proved. Thank you for listening, and I'm very happy to take any questions. And I hope I got you some good informations. Did you changing the...
Well, I have put one question into the chat. My son, who is now 30, we didn't follow the routine or the regiment because at the time that's when 30 years ago was when everything happened about all that kind of stuff. But one of the reasons why we did not was because of the age of the serum. How current is the stockpile of the serum, and how safe is the serum age and the side effects? Is there any correlation with that?
Oh, this is a good question. Like he 30 years, you said, right? 30.
Yes.
Okay.
30.
Yeah. So if you ask about the children vaccine, now he has passed some of them. He cannot have them, like rotavirus, like hip. Like I told, some vaccine we give in the first year, some vaccine we give in the first month, some vaccine we give in the first day. This is one issue, will exclude some vaccines from him. The second thing, during the 30 years, he is living in the community. He should have been subjected to like maybe subclinical infection from varicella, from measles, from rubella. You know what I mean? From tetanus. He had so he should have some herd immunity. He's lucky he didn't get like disabling disease. I hope so, or something. So he escaped some vaccines. He cannot have them. Other vaccines like hepatitis, varicella, measles, maybe he had like a subclinical. What I mean by subclinical, sometimes you get an infection, it doesn't show symptoms, but just it triggers the immunity in your body, and the body makes army. Like this is the army defense. When like detects antigens in the body, it is defensive army, which are the antibodies, and they fight and they kill and they engulf the infection without showing symptoms. So we cannot answer a specific answer to your son, but he should see his physician. First, he will see.
Oh, he has been vaccinated.
Oh,
I was concerned. I mean, he was eventually got all of his shots, but one of the reasons why I held off was the sermon, the actual vaccination, the shot was old and past its Felicia, what's the word I'm looking for? It's
where do you mean or what?
Expiration date? Expiration.
yeah, it was the vaccination. One of the reasons 30 years ago was that the vaccination supply was old in itself, which then became a problem. Are the serums current? Is there a current are they not expired?
No, no, now there is nothing like this.
Okay, so the age of serum, the serum doesn't have any ill effect.
No, it doesn't.
Okay. Because that was one of the reasons why we held off. I mean,
I
Malcolm
got you. I got
eventually
you
got
now.
everything,
Yeah.
but
Yeah.
okay, thank you.
You're welcome.
I'm just curious, what lasts longer, the nasal administration or the injection? So what has a longer efficacy over flu season?
It is the same. Is like a 1 year maximum.
Okay.
So you have to take it annually. So it is based on the research that this vaccine, either intranasal or IM, it is a 1 year. You have to take it annually. If it's the first time to take it, you take 2 a month apart, or if the second time, you take 1 each year. So they are the same period.
Okay, thank you.
You're welcome. Any questions?
Well, I'm just confused about the COVID-19 shot. Some doctor says like I was going to get my 4-year-old vaccinated because he had started school this year, and his the way his doctor was saying that basically like she don't recommend it right now because you don't know the side effects and all that. So of the shot. So that's his doctor saying that. So it got me confused. I don't so we end up not getting it. But my 10-year-old, I got her vaccinated last year, and now I'm wondering to myself, was that the right thing to do? So I'm just confused.
Yeah, you have the right to be confused. There is a lot of discussion about COVID vaccine. But first, let me start with something. We never mix up children vaccine, which is the basic vaccine, with COVID. That is a very well established and very, like I'm talking about this in this lecture. About COVID, the a lot of people say that this is causing this, and a short period. Anyhow, it is approved by the FDA. They should not approve it unless it is safe. That is the rule in America. But if you want me to compare it to our children vaccine, no. I'm talking about the children vaccine, and it is very well established safety. No worries, no like discussion about it. COVID, you can take or you can not take. It is up to you. Talk to your doctor about that.
Okay. All right. Thank you.
You're welcome. Yes, yes, please.
Yes, sir. My concern about the COVID vaccine is normally when we hear about how the FDA has a multi-year process to review the efficacy and effectiveness of vaccines, but yet for COVID, in a highly politicized environment, those traditional controls were removed for a rapid. So my question is twofold. One, why did the FDA remove traditional controls in terms of reviewing the efficacy? And then the second question is, if the FDA can do that for the COVID vaccine, why is that same review process applied to other medicines? It just seems like with COVID, a lot of the rules that were traditionally in place were suspended. And that to me causes skepticism, because it's either A, the FDA introduces unneeded bureaucracy, or B, they ignored safety controls. I know that's a long question, but that's my concern as a parent and even as a person.
Go ahead. Go ahead.
So that's it. I mean, I guess the question is that if the FDA can suspend traditional testing requirements, then why don't they apply that to why was COVID the first time they've done, well, at least why was COVID the first time they've suspended these rules? And if they did suspend the rules, then why have rules in place in the first place?
Oh, okay. Thank you for the question. It's a good question. Anyhow, sometimes, if you are in a crisis, like what happened in COVID, if you have a flashback out, like the death toll in America going to 250,000, and if you remember in Europe, in Italy, and in Great Britain, they stopped treating the people above 65 and treat the young people, let those die. That is a crisis. So when you are a crisis and you're looking for an acute solution, you can't wait. This toll is climbing and these things. That is the rationale of the FDA. So they broke the rule here and they just do shorter studies, shorter application, and then they approve the vaccine because of the crisis. But regarding the children vaccines, we cannot do that. Because first we have like solid base data for the vaccine safety, and it has channels to go through the CDC, through the FDA, and also the American Board of Pediatrics and American Academy of Pediatrics. All authorities convene and try to make the best. But for this COVID vaccine, I have no explanation except what they said. This is a crisis, people are dying, let us try something to protect the rest. You know what I mean?
Oh, so you're saying that it had shorter testing.
Yes, COVID has a shorter testing, and this has been asked to the CEO of Pfizer, has been asked to Dr. Fauci, the head of the CDC, the previous head of the CDC, and that is their explanation.
Oh, so that's why my doctor is saying, because it hasn't been tested long enough. That's why
Absolutely.
she's saying that you don't know. Okay, so I understand now. Okay.
Yeah, I can tell you that is not studied very well, but it is approved by the FDA. That's what I know. But no studies like what we have for the children vaccines. No.
All right, thank you.
You're welcome.